They live on the streets and their needs can be complicated. Providing medical help to the homeless can be challenging, but an innovative program in Ottawa has been specially designed to take on some of those challenges, and it's got cities across the country taking a closer look. Kim Brunhuber went for a ride to check out how it works.
This is Ricky out panhandling.
Downtown, on almost every corner, everywhere he looks, Dr. Jeff Turnbull sees a patient. If he doesn't already know them, it's a pretty sure bet that he will. House calls for those with no homes. On today's rounds, a handful of Ottawa shelters that have beds and nurses to offer medical services for the homeless.
Are they hurting you?
It's called the Targeted Engagement and Diversion Program, TED for short. Its mission, to keep the homeless out of hospital.
When these people do come to the hospital, they don't get good comprehensive care.
A frank admission from a hospital executive. But take Douglas Cottrell.
Hitting the water was enough to wake up and realize something had happened.
He blacked out, fell into the Ottawa River. In the ER, he'd be treated by doctors who don't know his underlying medical problems. Instead, he's being looked at by someone who's practically memorized his chart.
Most people would be in hospital if they weren't here, yeah.
I am a pill addict, okay? I usually do all my medication in one shot.
How do you feel your use has been now? Do you feel it's been...
When he OD'd at this shelter, Nurse Megan Brown rushed to his side with the antidote and brought him back to life.
They had to shoot me twice with it.
And what would have happened?
If I would have died.
And it's not just saving lives, it's saving money too.
We had one of our individuals coming into the emergency department 191 times in the 6 months before coming into the program. So that is massive costs to the healthcare system.
Since it got off the ground 2 years ago, Dr. Turnbull has advised other interested cities about the program. The next step, getting paramedics to bring the homeless here too.
My hand.
On his way home, Dr. Turnbull runs into the man they call Max from Newfoundland.
Give him beer.
They share a few laughs and then, of course,
Hey, let me have a
I'm
listen.
serious. My lungs is bad.
he pulls out his stethoscope.
I've been in the hospital more times.
Just take deep breaths.
Kim Brunhuber, CBC News, Ottawa.